those living with migraine to speak openly about their disease, Deborah started a public Facebook page called Her Migraine Life. So please check it out, on which she openly shares about her experiences related to migraine. She is passionate about education, self-advocacy, and especially countering migraine stigma. Deborah is a Philadelphia native. And with that, I turn it over to Deborah. Okay, Deborah, you're unmuted now.
Okay, thank you, Shirley. Just going to get my screen up. I'm having some difficulty.
So just click on share screen at the bottom. Do you see a green?
No, I know that for some reason when I'm sharing my, oh, no, never mind, I got it.
Take your time.
Okay.
I just want to add that after Deborah has her presentation, we will be taking a break. I encourage you then to visit the exhibit hall and get more information about our sponsors today, have great information on migraine. And I just want to also note that the name of Deborah's talk today is why advocacy should be part of your treatment plan. And there we go, Deborah.
Okay. All right. Thanks a lot, Shirley. I really appreciate it being invited to do this. Hi, everyone. As Shirley said, I'm Deborah, and I've attended every Philadelphia Miles for Migraine Education Day as a volunteer. And I never thought that I would get the opportunity to present here because I've never considered myself an expert on anything in the area of migraine. But I guess no one knows my journey, my advocacy journey better than I do. And after listening to Dr. Young speak about the importance of combating stigma and Jill speak about the importance of advocacy, I think I'm really honored to be able to share my story of how I went about my journey. So just a little bit about myself. I'm 45 years old. I'm a Philly girl, born and pretty much raised here. Coming up, my family had some pretty tough times, but we made it through, and we're still making it through. I have 3 children, 2 daughters and 1 son and 1 grandson. I don't have a whole lot of friends, but I value the ones I have, including the new ones in the migraine community. Just want to say hi. So I'm what some people will call a nerd, and I guess I am kind of a nerd. And that's okay, because I like comic books and superheroes and Star Wars. But I also love Godzilla movies. The cheesier ones are the better ones. And I love comedy. Most people don't know because I pretty much keep a stoic face, but I'm usually thinking of a joke, and I really love to laugh. So that's a big part of it. Laughter is important in our lives, and I truly believe that. My timetable, I really didn't have much of an indication in my childhood that I didn't have headaches but I started to manifest in college. I went to the ER for the first time at age 19, and then I was pretty much episodic 23, and then chronic at 35. And maybe I shouldn't have put diagnosed, because technically the words episodic and chronic were not used by any professionals. I know I was episodic in the years leading up to 23, and I know I was chronic before 35, but I didn't truly hear those terms until I started educating myself about migraine. And when my children were younger, migraine wasn't a big factor in my life. Throughout my life, I'd always been in good physical condition. In school, I was always one of the most athletic girls, fastest, most sit-ups, push-ups. I could have been on track team, but I was always working, so I could never do any of that type of stuff. But with my children, I was very active. Our house is on a hill. I would run up and down the hill with them, pushing them on their toys and stuff like that, and just having fun with them. I always wanted to fully support them, my children, so I went on class trips. I volunteered at their school, all home and school events, back and forth to lessons. And I always kept activities in our schedule. I mean, sometimes even after working all day, I would grab the kids, get the kids, grab their bikes or their Hot Wheels and head to Kelly Drive. I just hated to waste a nice day. If a friend asked me to go out, yep, I'm going, especially if there's dancing involved. 'Cause I would shut the dance floor down. I really like to dance. And I enjoyed our present. I really did. I enjoyed our present. I look forward to the future. I'd always wanted a career through which I could help people. And as Shirley stated, I did. I started in human services and I went to mental health. So just go to the next slide, which is just a picture of my children. If you see the first picture, you see my son is not happy about something. That was us one day on Kelly Drive. I wish I could remember because I'm sure it will be funny. And the next picture of us in Ocean City, Isaiah's still making a face, but I think he was just making a face. I don't think he was mad in that one. And just more like my children and I, our family got around, you know, and we did a lot of things, and I was happy about that. And there's me at work with my scrubs on, and I want to tell you, I still have all my scrubs, and I haven't worked in almost 3 years. I just don't have the heart to throw them away. I'm thinking maybe there'll be an opportunity where I can help take care of people one day that I'll need those scrubs again. And so I still have them. And if you see the picture on the right, that's me at a club. I'm not sure why I'm sitting on the counter, but I'm doing something, and my sister snapped a picture. But I put this picture up there because I was wanted to comment on my boots. Those boots had heels on them, and I danced in those boots all the time. And one day, one night actually, I discovered I couldn't walk on them anymore, walk in those boots. And as a matter of fact, as my migraine progressed, my balance was affected, and I no longer could walk on any of my heels. And you know, that was a sad moment for me. It was a loss for me. At first, I thought it was kind of shallow, but now I understand that it's okay that I grieve that part of my life. So, throughout my childhood, I always planned what type of life I wanted to live, what type of woman that I wanted to be, and what type of mother I would be. And I guess I thought that, if I was all these things, a super mom, active in my community, I was popular with the patients, respected employee, dependable friend. Oh, also I'm a 2-time spelling bee champ. That's kind of random trivia, but those are things that, in a nutshell, maintain control. If I could do all this stuff, then I would be. That's what I'm supposed to be doing. I'm doing right. I did what I said I was going to do. But as time went on and I slid further into chronic migraine, my attacks became more severe. They started to last longer. And I had to stop doing things that I felt that I had to do. And I had to stop doing things that I wanted to do. And this picture here of Vincent van Gogh, who I call our migraine brother, as he suffered with migraine as well. And when I look at all the feelings that I have here, with all the loss that I felt, and the gains that were all negative, pain, fatigue, time in bed, feelings of hopelessness and bewilderment, like what is going on? It just, I look, and the dismay that his picture shows, like this is where I was. I feel like I completely understand. I will really speak to someone if they say in my hearing that Vincent van Gogh was crazy, because I can identify. And so I finally went to my first neurology clinic, and I wasn't really satisfied with that experience because it was like I kept getting different doctors, and they were just changing up. I was going like every 6 months. When I needed to communicate with one of the doctors, I would have to leave a voicemail. Sometimes I would get a call back, sometimes I wouldn't. On my appointments, I got very little explanation as to the decisions, very little, no education actually about what my disease or what was happening to me. And I was getting worse, growing worse all steadily. And I have chocolate and red wine there because, oh, they always said that one. And I'm not saying that chocolate and red wine are not triggers for people, but I think with all it's just interesting that those were the only things that seemed to be steadily said to me. Don't eat chocolate or drink red wine. So eventually I did get one neurologist. Um, and when I met him, I said, how come I didn't get to see you before? And he said, well, what insurance do you have? And I realized that because of the insurance I previously had, I was only allowed to see residents who were constantly rotating. So I was happy that I finally got a neurologist. But with this neurologist, he wasn't really engaged. It seemed that it was like my treatment seemed random sometimes. Like I know he kept switching my meds. Some of the time it felt like there was like no rationale for some of the decisions, but I didn't really know anything at that time. But I say the last thing that happened was he prescribed an increase in my preventive, and it wasn't I knew something didn't sound right with it. And later on, I found out that's not even the therapeutic dose. He went over the maximum. But so when that happened, even though I didn't know for sure, I was just like, you know what, something has to change. So that's when I decided something, it was time for me to do something different. So what I did, it says, when I say stop and ask for directions, that's exactly what I did. Um, I wasn't going to keep going on lost. I refused. So I went on my first medical leave. And during that, I used that time I decided I'm going to learn about my condition. And I knew there were other people out there like me. I needed to find them. That way I could finally get a sense of direction. And now then I would be able to draw my own map. So what I did, I went downstairs in the family school supply box. I grabbed the composition book. I sat down with my tablet and I just typed in the word migraine in the browser. And the first thing that came up was a well-established website that was dedicated to migraine. And through it, I started to learn some of the science behind the disease of migraine, what's known, what's not known, various treatments, the number of people that are thought to have to live with it, various symptoms that go with it. So I found validation when I learned about these other symptoms that go with chronic migraine. I wasn't crazy imagining them. I wasn't dying either. But I also learned how underfunded research for migraine is. And that's when I was angry when I read about that. It was terrible. And I also learned that there are organizations that exist for migraine. At this point is when I started to see hope for the first time. I was suffering, but I was starting to physically still, but I was starting to see my first glimpse of hope. With There's a reason why through history, certain societies that have wanted to oppress certain citizens and maintain dominant positions of power will put barriers before or outlaw education of those citizens because there's empowerment in education. With education for me, as I learned more, my personal anxiety decreased. Now, having knowledge now, it's not that I have to sit here and wait or have all these question marks floating around. Now I was able to seek partnerships with my medical providers. And if I was encountering a medical provider who didn't want to be partners, then he was fired. Um, Now with education, I could educate my family about migraine, what I was experiencing. I could educate my friends, my coworkers, and I could also share information with others that were living with migraine. I also went on social media, and I went on Facebook and I typed in migraine, and this group popped up, Chronic Migraine Awareness. There weren't many Facebook groups back then, and the experience that I had with them, it was just wonderful. I loved it. Just the safe space for free expression. Got to receive comfort from others in the groups, give comfort, information exchange. I learned so much from the people in the group, and the shared victories, the things that no one else could understand, but we could understand. It was awesome. And then on the migraine website I spoke of, I read about an organization having a walk race in Philly. And I was like, what? Okay, I have to be there. At that point in time, this map didn't look like this. At that point in time, I believe the map had San Francisco and Philadelphia, and that's it. So uh, we've grown along a lot since then, haven't we? And I decided that I was going to volunteer. And it's interesting that my next slide seems to be missing. Oh, where'd it go? Oh, here it is. I guess but here is the slide for the first day, the first race in Philadelphia that we volunteered for. And I say miserable yet ecstatic because, as Shirley said, it was raining and freezing. But honestly, it was probably one of the happiest days of my life. And after that, I continued to volunteer at the races. First couple of years, 2 years, I was at the nourishment table. And Shirley doesn't know, but I had to fend off these runners that kept trying to grab bananas off the table and stuff before the race. Like that was pressure. I had to be tough, but I ended up doing it. I made them wait. But see me announcing winners at the race, and then the third picture, I was also at the store doing packet pickups and stuffing bags for another race. My mom actually came and volunteered with me the year before at that site to do the same thing. I wish I had gotten a picture with her, but having people volunteer, people in your family and friends, it's such a wonderful feeling. Everyone should definitely, if you can include your family and friends, that's a wonderful thing because they become strong advocates as well. And this is a picture of my oldest daughter, Nia, who came out of town to volunteer. And this is a couple of my friends, Jakara and Dave, and it was just wonderful. And as I said, the first 2 years I did the nourishment table. Third year I started with registration. I ended up running around the rest of the race. The next 2 years I ended up running around pretty much the entire race doing stuff. But the last year, Shirley asked me to do some interviews, and that's what I did last year. I asked the question of people, what do you want people to know about living with migraine? And that leads me to talk about why I realized through everything that there is this lack of understanding about migraine, this lack of funding, this huge stigma, and the lack of voices. And I noticed that the people that are in the group, the women, and I know I can only speak for women, they're hesitant to speak in public. They would share a whole lot in the groups, but they wouldn't. We need to speak up about our experiences and able to raise awareness. So I decided that I would do that, and that's why I did do the public Facebook page so that anybody could go on there and see what I'm talking about. I wanted to name it My Migraine Life, but that was already taken because I typed it in the computer and it came up this picture of this blog, which is the first blog that I ever saw, and it's a great blog. I would love to talk about how great blogs are, but I don't have the time. But if you can review this, see this one, please visit it. But yes, I call it my migraine life, and I shared everything. This picture is where one that I posted where I was in fog. I had our little, brain fog that we have, and I went somewhere and I realized my shoes were on the wrong feet. And the second picture is me in the ER. I'm in the hallway because I didn't receive a room. They they put a migraine patient in the hallway. You would think that only happened once, but that actually happened to me twice at two different hospitals. I never got a room in the ER. I had to face some truths after all of this, and the truths that I have now are, I have physical truths. I have a picture of us in front of the National Museum of African American History and Culture because it reminded me, I was reminded of when we visited as a family and we were walking up some stairs, and I had to stop while my family walked up the stairs because I didn't have the strength to make it up to the top. And at that point, my spirits felt pretty low. I didn't say anything to anybody, and they didn't even know. And I finally walked back up there slowly. But yeah, that's just the way it is. No more running and jumping and things like that. My health is unpredictable. I'll never be well, but I do have options, and they're just different options. Another truth is that I'm a lot more slow on the uptake cognitively, but you know, uh, things have changed, but I'm sharper in different areas now. That's how I look at it. And the next truth, financial. I've experienced financial devastation with my chronic migraine, and I'm not able to work anymore. Um, so of course, loss of income, loss of independence. These are all things that I faced. No more family vacations, no more amusement parks, no more upgrading cars. Home maintenance is difficult. But you know what? Out of this experience, I've now been able to become honest about my needs, and I've been able to do something I've never done before, which is ask for help. And I was able to experience I was invited to share my story in the second migraine edition of the Invisible Project. And that was great. I've been able to, this was my first year volunteering with Miles for Migraine booth at the Women's Conference, the Pennsylvania Women's Conference. I put amazed because I was amazed about the women that had never heard of an organization for migraine existing, never received treatment for migraine, and didn't know any of their rights. And I was happy that honored that I could help them start their journey to empowerment and advocacy. This also, I was able to be sent to trainings by the U.S. Pain Foundation to facilitate a migraine support group. This is our picture. And I now am a co-facilitator of a community migraine support group, and it's a wonderful experience. And I was also invited to attend the retreat migraine, where all of us came together. So I really, this was such a wonderful experience. You see me way in the back, standing next to Sarah, who is the blogger who does my migraine life. We thought we were had a good idea, but now we're ants back there. And I must say, um, I began my advocacy journey some years ago, but it's still a very important part of my treatment plan. It gives me purpose. Helps me focus. It gives me a voice. It's definitely been a rough road at times, and it still is sometimes, but it's led me here, and I appreciate where I am. And the journey continues. So now I just look to see what's next. Thanks, everybody.
Yes. Thank you, Deborah. So as you can see, telling your story is very impactful. I hope that hearing Deborah's story had an actual impact on you and you feel confident to tell your story when the time arises. Right now, we are going to take a 15-minute break. We are on schedule. And so we're going to come back, actually not 15, we're going to come back at 12:45. And we're going to have a demonstration on medical devices. The link for the next meeting is in the chat, which you can go down to the bottom of your screen. And there's an icon called chat. And I have put in the next session in there with the password. So please go take a break, get something to eat, and you can actually eat during the next session. And so we'll be back shortly.